everywhere.
A Montreal infant died from COVID-19 here at St. Justin Hospital on Thursday. The baby was under 2 months old and healthy at birth, said the hospital in a press release on Friday afternoon. The infant was recently admitted to St. Justin's ICU in connection with COVID and died on December 16th. Offering their condolences to the family, the hospital says in a statement, CHU St. Justin reminds everyone that infants are more at risk of complications related to COVID-19 and preventative measures of transmission of the virus are necessary. Reduction of contacts, wearing of a mask, washing of hands, respect of distance of 2 meters, and vaccination of relatives. The hospital is providing no other details about the case and no interviews due to confidentiality, they say. Dr. Jessie Papenburg, pediatric infectious disease specialist at the Montreal Children's, says,
what we know from the Public Health Agency of Canada's surveillance data is that children under 1 year of age have a higher rate of hospitalization than older children. And that's really quite normal for pretty much every infection. We know that babies in general are more susceptible to severe disease if they do catch an infection.
Deaths of young children in Canada from COVID-19 have been extremely rare. In Quebec, 2 teenagers have died from the virus, including a 16-year-old girl also here at St. Justin's, the province's youngest victim until now.
With respiratory viruses, common colds can be quite severe, actually, in young babies under 3 months of age. It has to do with the fact that they have very small airways in their lungs. And when those airways get plugged up with secretions or mucus, they can run into big trouble and require either support with oxygen or respiratory support.
Dr. Papenburg says there are ways to help protect our babies from severe infection.
And we also know that vaccinating the pregnant woman is important to be able to prevent severe disease during pregnancy, because pregnancy is a major risk factor for severe COVID-19. But also that if the mother gets vaccinated during pregnancy, she will pass on some of those antibodies to her baby during the 3rd trimester, and that is presumed to offer some protection for the first few weeks of life. And same thing during breastfeeding. There are COVID-19 antibodies that would be present to help protect the baby.
In Montreal, Brittany Henriques, City News.